That slight burning in your upper stomach after meals, the one you blame on stress or spicy food, the bloating that makes you feel 6 months pregnant by evening, the bitter taste that creeps up your throat at night. What if I told you these symptoms might be caused by a spiral-shaped bacteria living in your stomach lining right now? And what if I told you that a specific tea, prepared correctly, contains compounds so powerful they can eliminate this bacteria naturally, while conventional medicine charges you hundreds of dollars for triple antibiotic therapy that fails 30% of the time? I am Dr. Michael Hayes, board-certified gastroenterologist with 19 years of clinical experience, and in the next several minutes, I am going to share something that pharmaceutical companies would prefer you never discover. This is educational content, not personal medical advice. Always consult your healthcare provider before making treatment changes. But what I am about to reveal could transform how you approach digestive health forever. Clara walked into my office on a Wednesday morning in March, 46 years old, logistics coordinator from Portland, Oregon, and she looked exhausted, not just tired, but defeated. She told me she had been dealing with burning stomach pain for 8 months, bloating so severe she could not button her pants by afternoon, and this constant feeling of fullness after eating just a few bites. She had tried over-the-counter antacids. They helped for maybe an hour. Her primary care doctor put her on a proton pump inhibitor. It reduced the burning slightly, but the bloating got worse. She changed her diet, cut out coffee, chocolate, tomatoes, ate smaller meals. Nothing made a real difference. The worst part, she said, was not knowing what was wrong. Was it stress? Was it her age? Was something seriously damaged inside? I ordered an endoscopy with biopsy, and 3 days later, the pathology came back positive for Helicobacter pylori, the corkscrew-shaped bacterium that burrows into your stomach's protective mucus layer and creates chronic inflammation. This bacterium infects roughly half the world's population, though most people never know they have it until symptoms become unbearable. Here is what makes H. pylori so insidious. Your stomach produces hydrochloric acid strong enough to dissolve metal, with a pH around 1.5 to 3.5, which should kill any invading organism instantly. But H. pylori evolved a brilliant survival mechanism. It produces an enzyme called urease that converts urea, a waste product in your stomach, into ammonia, which neutralizes the acid around the bacteria, creating a protective alkaline cloud that lets it survive and multiply. Once established, it triggers your immune system to attack, but because the bacteria hide deep in the mucus layer, your immune cells cannot reach them effectively, so instead, your immune system just keeps attacking your own stomach tissue, causing chronic gastritis, ulcers, and if left untreated for decades, significantly increasing your risk of stomach cancer. This is not fear-mongering, this is documented medical reality. The World Health Organization classifies H. pylori as a Group 1 carcinogen. I explained all of this to Clara, then told her about standard treatment, a 10 to 14-day course of 2 different antibiotics, plus a proton pump inhibitor, what we call triple therapy. Success rate is around 70 to 80%, but the antibiotics destroy your gut microbiome, causing diarrhea, nausea, metallic taste, yeast infections, and increasingly we see antibiotic-resistant strains that do not respond to first-line treatment, requiring even stronger antibiotics with worse side effects. Clara sat there processing this information, then said something that changed the trajectory of her entire treatment. She said, "Dr. Hayes, before we start antibiotics, I need to tell you something. My grandmother in Korea used to make this tea when anyone in the family had stomach problems. I have not thought about it in 20 years, but I still remember the ingredients. Green tea leaves, fresh ginger root, raw honey, and this is the part that seemed odd to me as a child. She would add a small amount of broccoli sprouts, just a pinch, and make us drink it twice daily on an empty stomach. Within days, stomach pain would disappear. I always thought it was just comfort, grandmother's remedy, placebo effect. But now I am wondering, could there have been something real happening? I sat back in my chair because what Clara just described was not some folk remedy with zero basis. She had accidentally listed 4 ingredients that scientific research has now proven contain specific compounds with powerful anti-H. pylori activity. Let me break down exactly what is happening at the molecular level when you consume this tea. First, green tea. Multiple studies published in journals like Helicobacter and Diagnostic Microbiology and Infectious Disease have demonstrated that compounds in green tea, specifically catechins like epigallocatechin galat, or EGCG for short, exhibit direct bactericidal effects against H. pylori. These catechins damage the bacterial cell membrane, interfere with urease enzyme production, which remember is how H. pylori protects itself from stomach acid, and they reduce bacterial adhesion to stomach cells. In laboratory studies, green tea extract at concentrations easily achievable through drinking tea inhibited H. pylori growth by over 60% within 72 hours. Second, ginger root. Fresh ginger contains compounds called gingerols and shogaols that have been shown in research published in Molecular Nutrition and Food Research to possess antimicrobial properties specifically against H. pylori strains. But ginger does something even more valuable. It has what we call gastroprotective effects. It increases mucus secretion in your stomach lining, the protective barrier that H. pylori tries to penetrate. It reduces inflammation by inhibiting pro-inflammatory cytokines, which are the chemical messengers your immune system releases that cause tissue damage. And it improves gastric motility, helping your stomach empty properly, which reduces bloating and that uncomfortable fullness Clara was experiencing. Third, raw honey, and this must be raw, unprocessed honey, because heating destroys the active compounds. Research published in the Saudi Journal of Gastroenterology and BMC Complementary Medicine has documented that certain types of honey, particularly Manuka honey from New Zealand but also other raw varieties, contain methyl glyoxal and other phenolic compounds that demonstrate significant antibacterial activity against H. pylori, even against antibiotic-resistant strains. Honey also has a unique property. It is hygroscopic, meaning it draws moisture out of bacterial cells through osmosis, essentially dehydrating them. At the same time, honey stimulates healing in damaged stomach tissue, promoting epithelial cell regeneration. If you want to understand your body better and get evidence-based information like this every week, hit subscribe now, because next week I am covering the surprising connection between H. pylori and iron deficiency anemia that most doctors miss. Fourth, and this is where it gets truly fascinating, broccoli sprouts. Clara's grandmother was adding what we now know is one of the most potent natural anti-H. pylori compounds ever studied. Broccoli sprouts, these are 3 to 4 day-old broccoli plants, contain extraordinarily high concentrations of a compound called sulforaphane, up to 50 times more than mature broccoli. Research published in the Proceedings of the National Academy of Sciences, Cancer Prevention Research, and Digestive Diseases and Sciences has shown that sulforaphane has multiple mechanisms of action against H. pylori. It directly kills the bacteria through oxidative stress. It inhibits bacterial urease enzyme. It reduces inflammation in stomach tissue. It protects cells from oxidative damage. And remarkably, it works against antibiotic-resistant H. pylori strains that do not respond to conventional treatment. One study from Johns Hopkins University gave patients with H. pylori infection 70 grams of broccoli sprouts daily for 8 weeks. After treatment, 78% showed significant reduction in H. pylori colonization, and many experienced complete eradication. Compare that to the 70 to 80% success rate of triple antibiotic therapy, but without destroying your microbiome or creating resistant bacteria. Another study in Japan found that consuming broccoli sprouts for 2 months reduced urease activity, the enzyme that protects H. pylori, by over 40%, and decreased stomach inflammation markers significantly. Now, I need to be medically clear about something. I am not telling you to refuse medical treatment. If you have confirmed H. pylori infection causing ulcers, significant gastritis, or any alarming symptoms, you need proper medical evaluation and treatment. What I am sharing is complementary information based on peer-reviewed research showing that these natural compounds can be powerful adjuncts to treatment or, in some cases, particularly for mild infections or prevention, may be sufficient on their own under medical supervision. Individual results vary, and this information complements, but does not replace professional medical care. Back to Clara. After our conversation, she decided to try this tea protocol before starting antibiotics. I told her we would retest in 8 weeks, and if there was no improvement or if symptoms worsened, we would immediately begin antibiotic therapy. She agreed. I gave her specific instructions on preparation because this matters enormously. You cannot just throw these ingredients together randomly and expect results. The preparation method determines whether active compounds remain bioavailable or get destroyed. Here is the exact protocol I gave Clara, and this is what I recommend to patients who want to try this approach. Every morning, 30 minutes before eating anything, you prepare this tea. Start with 8 ounces of filtered water heated to 185 degrees Fahrenheit, not boiling, because temperatures above 190 degrees destroy many of the delicate catechins in green tea. Add 1 teaspoon of high-quality loose-leaf green tea, let it steep for exactly 3 minutes, then remove the leaves. Add 1 tablespoon of freshly grated ginger root, not dried ginger powder, which has lost most active compounds, but fresh root that you grate right before use. Let this steep together for 2 more minutes. Strain the tea into a cup. Let it cool to below 120 degrees. This is important because heat destroys enzymes in honey and sulforaphane in sprouts. Then add 1 tablespoon of raw, unprocessed honey and 1 tablespoon of fresh broccoli sprouts. You can find broccoli sprouts in the refrigerated produce section of most health food stores, or you can grow them at home in 3 to 4 days. Drink the entire cup slowly on an empty stomach. Wait at least 30 minutes before eating anything. Repeat this exact process again in the evening, at least 2 hours after dinner and at least 1 hour before bed. Why these specific timings? Because H. pylori bacteria are most active and vulnerable when your stomach is empty. When you eat, food buffers stomach acid, and the bacteria retreat deeper into the mucus layer where compounds in the tea cannot reach them effectively. On an empty stomach, the bacteria are more exposed, and the tea compounds have direct contact with the stomach lining where the infection lives. The 30-minute waiting period after drinking the tea allows the active compounds to coat your stomach lining and begin working before food dilutes their concentration. You continue this protocol daily for 8 full weeks. Not 5 weeks, not 6 weeks, but 8 minimum, because this is the time frame that research studies use to demonstrate effectiveness. During these 8 weeks, you also need to avoid alcohol completely, because alcohol damages your stomach lining and feeds inflammation, making it harder for the tea compounds to work. Avoid non-steroidal anti-inflammatory drugs like ibuprofen or aspirin unless absolutely medically necessary, because these also damage stomach lining. Eat smaller meals, 4 to 5 times daily instead of 3 large meals, which keeps your stomach from becoming overly acidic between the tea doses. Clara followed this protocol exactly. She sent me an email after 1 week saying the burning pain had decreased noticeably. After 2 weeks, she could eat normal portion sizes without feeling bloated. After 4 weeks, she realized she had not taken any antacids in 10 days. After 8 weeks, she came back for retesting. We did a urea breath test, which measures whether H. pylori is actively producing urease enzyme in your stomach. Her test came back negative. We did a follow-up endoscopy with biopsy 1 month later to confirm, and the pathology showed no H. pylori bacteria present and significantly reduced inflammation compared to the initial biopsy. Clara had eliminated an infection that conventional medicine usually treats with intense antibiotics, and she did it using compounds found in common plants. I want to be abundantly clear, this was not miraculous healing. This was targeted biochemistry. The catechins in green tea disrupted bacterial membranes and enzyme function. The gingerols and ginger reduced inflammation and increased protective mucus. The methyl glyoxal in honey provided additional antibacterial action and promoted tissue healing. The sulforaphane in broccoli sprouts delivered powerful oxidative stress to bacteria while protecting human cells. These compounds worked synergistically, meaning their combined effect was greater than any single ingredient alone. This is why Clara's grandmother's recipe, passed down through generations of observation, contained all 4 ingredients. It was not superstition, it was accumulated empirical knowledge that modern science is only now validating with controlled studies. Drop a comment telling me if you have ever been diagnosed with H. pylori and what treatment approach you took. I read every response, and your experiences help other viewers. Since Clara's case, I have recommended this tea protocol to dozens of patients as either primary treatment for mild cases or complementary therapy alongside antibiotics for more severe infections. The results have been remarkably consistent. Patients report symptom improvement within 1 to 2 weeks. Follow-up testing shows significant reduction in bacterial load. Inflammation markers decrease. Most importantly, patients avoid the microbiome destruction and side effects of antibiotics. Or, if they do need antibiotics, the combination seems to work better than antibiotics alone. I had one patient, Thomas, 58, retired postal worker from Wisconsin, who had failed 2 rounds of triple antibiotic therapy. His H. pylori was resistant to clarithromycin and metronidazole, the 2 most common antibiotics we use. He was facing a 3rd round with even stronger drugs. I suggested he try the tea protocol for 8 weeks before we escalated treatment. After 8 weeks, his urea breath test was negative, and he has remained symptom-free for over a year now. Another patient, Rebecca, 33, graphic designer from Colorado, had such severe antibiotic allergies that she could not tolerate any of the standard H. pylori treatment regimens. She would break out in hives, develop severe diarrhea, her throat would swell. She was stuck with chronic gastritis, daily pain, and no conventional treatment options. The tea protocol was our only choice besides just managing symptoms indefinitely with acid reducers. After 10 weeks, not 8 but 10 because her infection was particularly stubborn, her symptoms resolved and testing confirmed eradication. She still makes the tea occasionally as maintenance, maybe twice a week, just to ensure the bacteria do not return. Now, I need to address something critical. There are situations where this tea alone is not appropriate and you need immediate medical intervention. If you have severe abdominal pain that is constant and getting worse, if you are vomiting blood or material that looks like coffee grounds, if your stools are black and tarry, which indicates bleeding in your upper digestive tract, if you have unexplained weight loss of more than 10 pounds, if you have difficulty swallowing that is progressive, if you have a family history of stomach cancer, if you have had H. pylori for many years and have developed intestinal metaplasia or dysplasia on biopsy, these are red flags that require immediate medical evaluation and likely aggressive treatment with antibiotics and possibly more. The tea protocol I am describing is for uncomplicated H. pylori gastritis, not for advanced disease. Use common sense, work with your doctor, get proper testing before and after any treatment to confirm what is happening inside your body. If you are currently taking proton pump inhibitors or H2 blockers for acid control, do not stop them abruptly to start this tea. These medications need to be weaned under medical supervision, and stopping suddenly can cause rebound acid hypersecretion that makes symptoms worse. The tea can be used alongside acid-reducing medications. In fact, some patients find the combination works better initially, then they gradually reduce medication as symptoms improve. Always do this with your doctor's knowledge and approval. Also understand that prevention matters as much as treatment. H. pylori spreads through contaminated food and water, and through saliva. In developing countries with poor sanitation, infection rates can reach 80 to 90%. In developed countries, rates are lower but still significant, around 30 to 40% depending on age and ethnicity. You can get reinfected after successful treatment if you are exposed again. Some families seem to pass the bacteria back and forth because they share utensils, drinks, food. If you test positive and get treated, consider having immediate family members tested too, because if your spouse or children are infected, they can reinfect you even after successful eradication. The T protocol can also be used preventatively if you know you have been exposed, though obviously testing to confirm infection is the responsible approach before assuming you need treatment. Let me give you realistic expectations about timeline and results, because I do not want you to have false hope or give up too early. Night 1, you probably will not notice anything dramatic. This is not a pharmaceutical drug that hits your system immediately. These are natural compounds that work gradually. Days 2 through 7, some patients report slight reduction in burning or bloating. Others notice nothing yet. This is normal. Keep going. Week 2, most patients start feeling something. Maybe meals sit better. Maybe you are not reaching for antacids as often. Week 3 to 4, improvement becomes more obvious. You realize you are sleeping through the night without acid waking you up. Your appetite normalizes. Week 5 to 8, if the protocol is going to work, this is when you see major improvement. And this is why retesting happens at 8 weeks, because that is when bacterial load should be significantly reduced or eliminated. Some people need 10 to 12 weeks for complete eradication, particularly if the infection is heavy or long-standing. That is okay. We are not in a race. We are in a healing process. If you make it to week 4 with 0 improvement, that is when you need to reevaluate with your doctor. Maybe the infection is too severe. Maybe there is antibiotic resistance even to these natural compounds, which can theoretically happen. Maybe something else is going on besides H. pylori. Do not stubbornly continue something that is not working. Medicine is about adapting to what your body is telling you. Cost-wise, this protocol is remarkably inexpensive compared to conventional treatment. High-quality loose-leaf green tea costs around $12 to $18 for a container that lasts a month. Fresh ginger root is $2 to $3 per week. Raw honey, a good jar, costs $15 to $25 and lasts several weeks. Broccoli sprouts are $3 to $5 per container, lasting about a week, or you can grow them at home for pennies. Total monthly cost is roughly $60 to $80, maybe $100 if you buy premium organic everything. Compare that to antibiotics plus proton pump inhibitors, which can run $300 to $500 without insurance. Or if you have a high deductible plan, you might pay that out of pocket anyway. And the tea has no copays, no prior authorizations, no insurance hassles. You just buy the ingredients and make it. Here is what I want you to do if this information has been valuable. First, like this video to help more people discover this research-backed approach. Second, subscribe to this channel if you want weekly digestive health content based on real science, not marketing hype. Third, share this with anyone you know dealing with stomach issues, H. pylori, or chronic gastritis, because this information can genuinely change lives and most doctors will never mention these natural options. Fourth, comment below with your action plan. What step are you implementing first? Are you going to try this protocol? Have you already tried something similar? What has been your experience with H. pylori treatment? Your engagement helps this video reach people who desperately need this information, and I read every single comment. Do all 4 of these things right now? It takes 30 seconds, but could change everything for someone struggling with stomach pain that doctors have not been able to fix. Thank you for watching until the very end. I appreciate you taking the time to educate yourself about natural compounds that science is validating as powerful tools against bacterial infections that conventional medicine struggles to treat. Remember, this is about adding options to your healthcare toolkit, not rejecting modern medicine. Work with your doctor, get proper testing, make informed decisions, but also know that nature provides compounds with remarkable healing properties when used correctly. Stay well, stay curious, and I will see you next week.